All right. This is going to be good. It's going to be good. Let's do it.
Let's do it.
Let's do it. Welcome, Cadaver crew.
Get your dark little minds right and settle in.
Class is in session, and the Cadaver is already on the table.
I'm B.
And I'm Sam.
And this is the Cadaver's Files.
Your voice goes so high because you're trying to make sure you get it right. It's just going to be smooth.
Oh, sorry. Today we're talking about polio again.
Yeah. Case file for polio.
Case file. So who can forget about polio?
Well, a lot of people have, obviously.
Well, a lot of people forgetting about polio.
We're here to remind them.
Right.
It's a bad disease.
Should we do a little recap on the medicine real quick?
Yeah, it's a virus that's super duper contagious and spread through multiple different pathways, which is partly what makes it so contagious. And in some patients, it's minorly symptomatic. And in some patients, it causes paralysis of different parts of the body, depending on where it affects inside of the central nervous system. And so I think people oftentimes forget just how bad it is because there's like these asymptomatic essentially causes, but we forget that like people survived in these machines for years and years, and there's still someone alive today that does. So
yeah, and the fact that it was able to spread through many different ways just caused mass confusion and made it so much harder to pinpoint how best to navigate.
Yeah.
So let's talk specifically about the polio epidemic of 1916. And I chose this one because it's kind of the first time polio, but really any large-scale epidemic is seen in the United States. And even though there were pockets of polio that had come up and cases of, 50 people here, 70 people here, this was massive.
Yeah, the first
Huge,
widespread.
Large-scale deaths, especially in young population.
Yeah.
And then it's also one of the most well-recorded as far as the public health response to the epidemic.
Interesting.
Yeah, so
I have thoughts on why. It affected both males and females, white, black, any race whatsoever. It didn't disparage between heterosexual, homosexual, anything like that. So the government said, okay, we're going to do something about this.
Yeah. So, little background. 1916 polio epidemic impacted 26 states overall. New York, though, was the hardest hit and became that focal point on a national scale. There were 27,000 reported cases and approximately 6,000 to 7,000 deaths.
So almost a quarter of the people that were diagnosed died.
New York alone accounted for 9,000 of those cases.
Wow. So a third of them.
Yeah.
Wow.
And there was 26 other states, but New York had a third of them.
Wow.
Yeah. Nearly all the victims were children under the age of 16, which is, I think, another reason for the response.
Yeah, absolutely it was.
And then many cases went unreported initially, we'll get more into it, but which is why it took so long for it to be realized as an epidemic, because families were fearful of being quarantined. And then if they were quarantined, they couldn't leave their homes to go to work and all this kind of stuff. So, and we'll get more into it, as I said, but there was very strict quarantine regulations.
Are we going to talk about why New York got hit specifically so hard?
Yeah, a little bit. It mostly has to do with, we talked about it, but the cleanliness of their water supply.
Right. Yeah.
So big city, they were kind of...
And population density.
Yeah.
Right.
There's population. There is other things that people thought at the time were the causes, including immigrant populations.
It's always the immigrants.
Totally not true.
Yeah.
Unfounded. So let's see. Also setting the stage, remember, there's no vaccine. We barely even know where it's coming from.
Yeah. We don't understand how it's being transmitted.
Yeah, there had never been an outbreak to this scale. The medical community was deeply uncertain on how it spread from person to person and why it always peaked in the summer and then disappeared in the winter.
Yeah.
They couldn't figure out what was causing in the July timeframe, cases popping up everywhere. And then by October, November, it had essentially disappeared.
Yeah.
Some public theories about the cause of polio. So if you were going around the street and asking people
love their theories when they don't have any clue what's going on.
Like, why do you think polio was coming? And they thought maybe some poisonous caterpillars.
Yeah.
Or some moldy flower.
Okay.
Gooseberries.
Gooseberries. That's original.
contaminated milk.
Fair.
I mean, that's
fair.
That's a fair one.
Especially if like one farm is supplying the majority of New York because of the way that it's brought in. That can make sense.
And then like human spit in the sense of being like spit at, sewage odors. Just the odor. So like not.
I mean, they were getting
closer. There. It was like you got the milk and the spit and the sewage. You're like slowly getting there.
So, yeah.
But
the caterpillars is a little crazy.
The caterpillars, that's why I put it first.
Yeah.
Like, what are you talking about? Poisonous caterpillars. So while many physicians accepted germ theory, much of the general public and even some epidemiologists believed disease was caused by dirt itself.
Okay.
Yeah.
So they just assumed because kids in the summer were outside playing more and it was in the summer and kids were the ones being affected that it was dirt? Is that where this was coming from? Or do they mean dirt like uncleanliness?
Yeah.
Oh, okay.
Dirty people.
So
like dirty people spread disease, which leads you down the path of poor people.
Yes, as we tend to see over and over and over again in history.
Yeah. So even though you have medical professionals that believe in germ theory, the masses, what they think led to a lot of the public health outrage and the way that public health was enacted on the city.
Yeah.
So not necessarily science. And this is where it gets tough because you have a true health item, like a virus that's ripping through children, right? That needs to be addressed. And it's getting pulled into politics, racism.
As it always does, though. We're going to see this time and time again as we go through this. But people love having someone to blame.
Oh, yeah.
And it's always marginalized groups.
Absolutely.
Yeah.
So the epidemic likely began earlier than people realized.
Yeah.
Right? Because cases weren't being reported or they didn't know exactly what they were looking for.
Exactly the same with COVID, right? Like people, after they finally named it, were like, man, I was so sick a few months ago and nobody knew what it was. There's always that retroactive realization.
Yeah. So 29 cases were discovered in Brooklyn, but these cases had not been reported to the health department originally. They were found later during a house-to-house search that was tracking possible carriers.
1916.
In May.
Okay. In May. So relatively early.
Right.
We're at the early stages of the summer breakout.
Right.
Okay.
But the health department didn't know about that until later. And then Brooklyn emerged as the epicenter of the outbreak within New York. It was the hot spot where everything was kind of popping off.
Yeah.
And here's a quote from some of the health officials. Although a thoroughly alerted public and forewarned profession could have prevented the delay in official knowledge of the threatening epidemic. So only with a public that is well knowledgeable about the signs and symptoms and what to do about those signs and a progressive
medical professional group.
Right. And being able, both those are necessary in order to have a quick action response.
That quote to me feels like they're putting it off and being like, oh, we tried our best, but the public wasn't willing. Medical professionals weren't willing. And I'm like, I don't know. That's how I took that quote.
But. Yeah, there's a lot of things that are preventing people from reporting, that are preventing people from knowing how to go about treating. Like there's a lot of blockers and barriers to care that we're seeing here that are probably the cause. And I guess if this is why it was so recorded and they were so strict about, okay, this happened in 1916 and then in 1917 they had a whole manuscript written about it.
Yeah.
And how they reacted to it because they thought that they could change this.
Yeah.
That they could have forward-thinking professionals and that were thinking ahead of epidemics. And then the public was alert and able to.
Yeah.
But when you have, sometimes that turns poorly. You know,
I agree.
You have an alert public that.
You have an alert public that is not at their fault, but like not necessarily an educated public when it comes to medical literacy. And once again, we saw that even with COVID, we knew that people staying home, that, the 6 feet of distance, the masks, all of that did work. But then you have people that simply don't have trust in our government or in our healthcare officials or any of that. And so you I imagine this also happened then on top of so many other reasons for people not wanting to report their symptoms.
Yeah, so let's talk a little bit more about that public reaction and the social consequences. So the epidemic really exposed, as it always does, things like this always expose deep class and racial tensions. Upper and middle classes blamed poor and immigrant communities. Public health measures were targeted at those communities, especially those in poverty, which happened to usually be immigrant population. And then to add on to that, the actual hospitalization rules were favored toward the wealthy.
Of course they were.
So to stay home, to be allowed to stay home and not enter a hospital, you had to have a private toilet for the patient.
Okay.
So your family had to have a toilet, and then the patient had to have.
So 2 toilets in a room, or 2 toilets in a house.
Which is a lot in 1916.
Absolutely is.
What are you talking about?
Yeah.
You know? You had to have a separate patient room.
Okay.
So you have to have your own room and your own toilet.
Yeah.
And then you have to have a special attendant.
Like one person that takes care of you?
Yeah, and I think they generally had to be a medical professional of some type.
Who can afford to bring that in?
Right.
Yeah.
Exactly. So, and they had to be there to ensure that you weren't like making any meals or touching food that other people were eating, and that you were using only your contaminated area, you know, and you were following that. And so it was like a very strict, and poor families just could not meet that standard.
Absolutely not. But then also, like, think about the people that could be your quote unquote public attendant. Like, I very much worked the COVID pandemic and put myself in that. But do I want to go get paid horrific money to go sit at someone's house and ensure they're following these protocols and then just hope I don't get polio?
Yeah.
You know, like, on top of people can't afford this. The people that can't afford it, obviously we're about to go into, probably have to go into hospitals. The people that can't afford it have these people coming in that likely are in a very poor socioeconomic state to put themselves in that situation, is my assumption. You don't think so?
I don't know. It's tough. I think the nursing profession was different. Like the way this, particularly the article and the book that I was referring to, describes nurses and medical, I think we'll get into it, but they're called something else. The way it describes them, it's a very coveted position, and you have to be like well qualified. So
Or maybe not.
I don't know. But then you have
We
a
can cut it.
nursing shortage and all this kind of stuff. So
Yeah.
to your point. So the consequences of these super high standards to stay home meant that poor children were automatically hospitalized, which we know hospitals can become sites of secondary infections. And they ended up quarantining asymptomatic children just because they were poor.
Yes.
So it wasn't.
You might not have been exposed yet, but now you're going to be exposed.
Right, exactly.
Yes.
And because you have to go into the hospital because we think you might give polio to an upper or middle class person. So come into the hospital, and then they get sick in the hospital.
Yes.
And it's like that affirming bias of, oh, see, yeah, you were sick. And it's like, no.
Yeah.
They weren't going to become sick. You just put them in a place where literally there's hundreds of children.
Yeah.
Right? And so immigrant children were banned from city functions, camps. Wealthy families fled the city. Over 50,000 children were sent out of New York City during the summer. So if you could afford it, middle and upper class just sent all their kids away, which also probably meant they were going to other states and infecting other people.
That's where those 26 states came from.
Like they were probably sending them out there. But I will say that in order to leave New York City, children had to carry special passports that said that themselves and none of their family had polio.
And I think that's a fantastic idea. I also think there was probably some sketchy stuff that went on with that passport, right?
Forging.
We assume that people did the best, but come on.
Yeah. And so we talk about, Brooklyn and the neighborhoods of New York. So suburbia beyond, right, really had some strong reactions to what was happening in those neighborhoods. And so several of the suburbs isolated themselves, and non-residents were forbidden from entering. But you think about the people that work in the suburbs, that rely on their job to go there, they can't enter the neighborhood anymore because they're from the city. They're in the, they live in Brooklyn.
Yeah.
So, yeah.
Man.
Overall, the atmosphere was people wanted someone to blame or something to blame.
As they always do.
So whether that was people, like immigrants or poor, or fleas were also, like fleas and flies were also blamed, which is why animals were blamed as well.
I've never heard about animals being blamed.
Yep. They actually, I think I get to it later, but essentially the Humane Society back then had to euthanize like any stray cat or dog in New York. Yeah. So they had an extreme reaction to animals, even though animals can't carry it.
Yeah.
It doesn't come, and it doesn't come
Just
from
humans.
flies. Yeah.
Yeah.
So, and then people wanted to control who got polio and who didn't.
Of course they did.
You know, they were like, we don't want it, but like if those people have it,
that's fine.
It resulted in unjust reactions towards people and animals, like I said.
Yeah.
Animals getting euthanized off the street if they weren't dedicated to a home. So specifically, I wanted to bring up Oyster Bay because it's brought up a lot throughout other readings. And Oyster Bay is a perfect example of how public health is entangled with like politics, race, economics, and class. So it's a summer resort town. Naturally, you have your wealthy summer visitors, right? The people that are coming and staying over the summer. Then you have the less wealthy permanent residents, the people that make a living off of those people visiting.
Yes.
Right. So classic tourism economy. So the permanent residents depend on tourism for survival. And they were very opposed to quarantine measures that would destroy their livelihood. Because if you put everybody on quarantine, nobody can come spend their money.
Yeah.
Right.
And we don't have a way to survive financially.
Right. And they did not want to pay higher taxes for health services for wealthy guests. So they didn't want their taxes going to the wealthy guest to ensure that they were fine and healthy and receiving care when they weren't going to receive that same thing.
Which is fair.
Yeah, which is fair, right?
Which is fair. But also, do I recognize that they also didn't want to go on quarantine? Yes.
So many permanent residents were of Irish and Polish descent. So there you get your racial portion as well. And then because of their descent, increased the fear among wealthy summer visitors and reinforced the class and ethnic prejudice. So people didn't want to come visit because they're like, oh, the dirty Irish and Poles, you know, they're going to make us sick.
Yeah.
And then, but the people who live there want people to come so that they can continue to live. But then you have quarantine. And so it just kind of shows very specifically in one area how that can happen.
Yeah.
And that's happening everywhere.
Everywhere.
Right. Okay. So this is the book that I was talking about. It was written in 1917. And I'm going to give you some excerpts from this and a kind of a timeline because I thought it was really interesting because it talks about their response to the epidemic. And it's called A Monograph on the Epidemic of Poliomyelitis in New York. So we go from this rare disease to 1912. So a few years before, polio deaths were so rare that they weren't even separated from quote unquote other diseases of the nervous system.
Yeah. It didn't have its own diagnosis.
Yeah, they were just lumped in
to
other diseases of the nervous system. Whereas in comparison, in one 10-week period, August through September of 1916, death rates exceeded the total deaths from previous 5 years. So it's like you're having 5 years of polio deaths in
10 weeks.
Yeah.
Yeah.
Only 6 deaths were recorded before June 1st, 1916. So this is where we get that there were cases.
Yes, precisely.
Yep. There was the 29 cases in Brooklyn.
Yeah.
That went unreported. And there was only those 6 deaths that were reported before June 1st.
Yeah. So likely more, but only this many reported.
Right. And then from July 1st to September 9th, there was an average of 209 deaths per week. It's kind of going from 0 to 100.
Very quick.
Very quickly.
Yeah.
Right.
All in one summer.
Yeah. So some early on clinical observations were noticed specifically in Brooklyn, like we mentioned, in Baby Health Station 184 4th Avenue. So these were specifically infant health institutions. So like your pediatrician.
Yeah.
Basically. And in Baby Health Station on 184 4th Avenue, mothers reported babies were unable to hold bottles. There was limp legs, loss of appetite, restlessness. And overall, these mothers were unaware that polio even existed.
Yeah.
And what the symptoms were. So they were coming in and being like, my baby used to be able to hold their bottle just fine. And
why are we regressing?
Right.
Yeah.
And so they're concerned and don't know why this is happening.
And it's interesting because now we'd be like, pause, why is there this one specific spot, you know? But I'm sure then it was blamed on some sort of socioeconomic status or something like that of why these babies were regressing and the moms weren't taking care of them, or, you know, something like that.
Yeah, it was pushed off until it couldn't be
Absolutely.
pushed off anymore.
Yeah.
Yeah, so it wasn't until June 17th, 1916 that the first official press bulletin was issued, published in newspapers everywhere. Could you imagine? It's like you got to get your newspaper off your steps to realize that there's an epidemic happening.
Yes.
Right?
Yes. I saw a quote recently that said, like, we were right now in today's world, we were never supposed to have this much access to information and the world going on around us. And I was like, I completely disagree. I don't want to figure out about, quote, polio after it's already been a thing for months and months and so many people have died by a newspaper on my front desk and then not know anything else till the next time something's published. Like,
Right.
access to information is crucial.
Yeah, I think it comes down to accuracy of that information.
Which is a whole nother thing. I can rant about that.
And the bias of that information. So the focus of that first bulletin was the value of spinal fluid exams, and they offered free lumbar punctures by the Department of Health.
We're just handing out lumbar punctures?
Yeah, they were. For free.
That's wild. Those are so miserable. Okay.
Yeah. And then letters were sent to all Brooklyn physicians alerting them to the rising number of cases and asking for cooperation in helping with the Department of Health's execution of their upcoming items. An emergency field force is assigned with additional nurses and medical inspectors deployed. So these people are deployed out into the community, and the nurses conduct home-to-home searches of people who may have polio. And then they're quarantining households. So these nurses are going into a house and they're being like, one of your family members has polio. We're quarantining your house. We're putting a label on it. We're identifying it to the Department of Health.
Which is terrifying, right? Because we've talked about the polio symptoms. And so did they just have a cold? Did they have anything else going on? But then on the other hand, like, as someone who worked during COVID and saw when we had nothing for patients because we had ran out of all of our resources and I was reusing gowns. I also understand quarantining. And I know that makes me sound like a bad person, but until you've truly been through it and worked through it, I don't think you can understand.
Yeah.
Yeah.
Yeah, absolutely. It's better to be quarantined to your house than to a hospital or somewhere else.
For most people.
For most people. Yeah.
For most people.
I mean, some people.
Home is not a good place.
Home is not a safe place, which is a whole nother conversation of domestic violence increasing over COVID and epidemics because people are stuck at home with their abusers. So
there's no good
answer there. The inspectors, so the medical inspectors, would confirm diagnoses that were happening throughout the area. So they would go after a physician had diagnosed someone and be like, yes, you're right, this is polio, and then record all the information. And then they would investigate what you did, right? Who you came in contact with.
Yeah. They would trace you. Yeah.
So other measures, the ASPCA ordered to collect all cats and dogs that were strays, and they ended up euthanizing a lot of them. And then the Department of Street Cleaning had special cleanups in South Brooklyn, and they discontinued use of burlap trash bags because they thought that might be like the burlap was collecting polio somehow and spreading it. So this is kind of the Department of Health asking all these other agencies to join in and be like, what can you do? Okay, you go switch out your trash bags, or you do this. Yeah, so it's a wide scale, multi-department initiative that's occurring. In many cases, detection was not noticed for weeks, and people continued to spread the infection because they didn't know that they were sick.
Yeah, like we said, so many of these cases are just asymptomatic even now.
Yeah. So there was another bulletin on June 24th. So it's only been a couple weeks.
Yeah.
And they're sending out another bulletin.
I think it's been a week. It was June 17th.
Yeah, you're right. It's been a week.
It's been a week.
A week. And this bulletin was attempting to spread, quote unquote, facts, as it was understood at the time, across as many people as they could. Like, they're trying to spread the word about actual things that they know for sure. 90% of cases were children under school age. So they wanted people to know that it was happening to children that were usually 3 to infants.
Much younger.
Not technically your teenagers, not that your teenagers couldn't get it, but it was mostly under school age. Cases were not limited to one school or one classroom. So
It's diffused. It's
it's
everywhere.
all over the place. It's not just the school across the tracks.
Yeah.
That's getting it. You know,
Yes.
It's all over. The virus presented in nose and throat discharge and the bowels.
Okay. They're getting somewhere.
Yeah. Spread through personal contact. So they were specific about mucus and then
Stool. Yeah.
And that there's both non-paralytic and atypical cases.
So they figured out a lot in this week.
Yeah.
Of like going around and seeing people.
And the asymptomatic cases could be just as dangerous as the paralytic cases because you can spread it. And it's way more numerous.
Yeah.
So your paralytic cases are the rarer, as they're trying to say. Like there's people walking around with it and you probably don't even notice because they don't have to be paralyzed.
Yes. Which is super important to know, right? It's not just the person that is paralyzed in the house next door. You can still contract this if you are hanging out with people.
Right.
Yeah.
And then they were telling people antiseptic gargles or nose spray did not help. What I imagine is that they
were doing the ivermectin of the time.
Yeah, right. Yeah, they were like, this will work, if I just spray my nose a bunch of times, and then you got people coming in with a bunch of bloody noses and stuff. Yeah, and they're not helping. So I thought that was interesting. And then on June 28th come our quarantine regulations.
So 4 days later.
Right. So now they extended the isolation period from 6 weeks to 8 weeks.
It's a long time.
8 weeks of quarantine.
Yeah.
Yeah. And immediate hospitalization was required unless all conditions were met. So that's what we talked about earlier. Daily physician visits was also on there.
Yeah.
So your doctor has to come see you every day.
I don't want to be a doctor in this time.
Yeah. Your special attendant had to ensure that you or they weren't receiving any outside contact. And then separate rooms, screened windows, separate from the family toilet. Additional rules: if you were handling food in a house, like the people who were infected couldn't handle food.
Yeah.
Yeah.
Yeah. We're trying to spread it.
Bed linens were disinfected or removed, thrown in fire. And then afterwards, the room was required to be renovated after the patient removal.
And like, what does that mean, renovated?
Yeah.
Do we just mean like we need new bed linens? We'll change the curtains, we'll do a deep clean? Like, what does that mean?
It was not specific.
No.
Yeah. And what this did is it resulted in hospitals being extremely overwhelmed and the isolation facilities expanded as well. So because of this, hospitals had to expand. The whole infrastructure of medicine had to expand within New York. So on June 29th, the next day, Queensborough Hospital opened and relieved the crowded Kingston Avenue Hospital, which had been where everybody was going because it was in Brooklyn.
So is this like essentially a makeshift hospital? How did it open so quickly? Is it tents?
I think it was already existing hospital, but they expanded portions of it.
Okay.
And so the screened porches were used as places to put patients.
It's not a bad idea.
Yep. And then they had nearby housing available for nurses to rent.
Okay.
So they would put nurses, kind of like travel nurses.
That's exactly what they were doing.
Yeah. So they would bring nurses in and they would stay in a house next to the hospital. And then their commute would be a walk down the block.
Yeah.
Yeah. And then their capacities increased from 80 to 112 children.
Yeah. That's not that much when you think about how many children are infected.
Yeah. So they're still overcrowding. But this kind of shows how hospitals were trying to expand and adjust for the massive influx of patients.
Yeah.
And then on July 2nd, they also had ambulances donated to New York, and there was additional private ambulances assigned to the city as well.
To go and get patients, or for patients to stay in while they were sick? Maybe a mix of both.
Yeah, probably a mix of both, but they didn't have very many. It was like 9.
Yeah.
For like Brooklyn.
Yeah.
So they had to go get more because they were needed to retrieve patients or to transport patients from one hospital to the next or to an isolation facility. So I think it was that the transferring caused a lot because you need an ambulance. I mean, you need some kind of...
We don't just want to walk this infected polio patient down the street.
Yeah. Yeah. Plus, if they need any kind of breathing apparatus or help, then it gets even worse, right? So here's some of the citywide restrictions. July 5th, all the theaters are closed down to children under 16. So kids, you can't go to the theater anymore.
No more.
July 8th, all the play streets are shut down. So this is in New York. They had whole streets that would be protected for children's play, kind of like a playground, but they were actual streets.
Yeah.
Yeah. And the police surveyed those streets to ensure that people weren't out.
Make sure kids weren't out playing.
Playing on them, right?
Yeah.
Some banned activities included street carnivals, parades, public picnics, excursions, anything that you, for fun, that you wanted to do.
Yeah.
Not doing it anymore.
No.
Like I mentioned before, New York City children were required to have ID cards saying whether their families did or did not have polio. And so the only way you could exit New York was if you had one that said that nobody in your family had polio.
I wonder how long they were good for. Like it can't be more than what? 7 days?
Yeah, I don't know. You have to go to the doctor, to the physician to get them stamped every time. Yeah, which means that if you don't have access to that, you're not going anywhere.
You're not going anywhere. You're going to be stuck with the real cause of polio, which is the poor sewage and everything else.
Yeah. These restrictions remained until mid-September. The other thing that they did with the Department of Health is medical education clinics.
Mm-hmm.
So July 24th, they launched their special polio clinics, which had additional sessions beginning August 14th. So they're trying to do them every couple weeks to keep people informed. The topics that were covered was the disease overview. So, where does it come from? How do you protect yourself? What does it look like? What are the symptoms? All of that good stuff. And then the next portion of it was like a case study. So they would bring people in to explain, okay, like this is a case. Here's the history. Here's how it affects you physically, as you can see by this. So they actually brought people in and explained the cases that were happening in order to help people connect what they were learning to an actual case. And so they did those for weeks. And then they also tried to intertwine treatment regimens, nursing, because this was affecting young children. So they were specific to infant nursing and things like that. And then special procedures. So they talked about immune serum injections, artificial respirations, massage and passive motion, and splinting. So all of those things that we talked in the first episode, they kind of went through and discussed during these clinics as well.
Yeah. I mean, that's cool that they're doing it.
Yeah.
Yeah. Just trying to get the word out. And this is what we know. This is what we can do.
Right.
Yeah.
Yeah. So that's what they did until it went away in November timeframe.
Yeah.
So did it help? Unclear. But this was, like I said, the first really recorded, where the Department of Health went and documented step by step what they had done to face this epidemic.
And I don't think you can argue that it didn't help, because we saw in the time from the first bulletin to the second bulletin when they were going house to house, which is terrifying that they were going house to house. And I recognize that. Terrifying. But also they learned so much about the disease this summer that they likely never would have known. I shouldn't say never would have known. That would have taken years and years to understand at this point. And so it did help, right?
Yeah.
Like we're starting to understand the way it's transmitted. We're understanding what treatment options there are. Like we're getting all of that. And so I get it's a terrifying time. It was an awful summer. We lived through something similar, maybe not quite as severe, but
I mean, so you're on a different.
Yeah.
I think lots more people died from
Yes.
COVID. And so severe also. I mean, this is, like I said, 26 states, but localized specifically in New York. And I think what we learned from 1916 was that epidemics generally transform into more than just a medical crisis.
Yeah.
Right? They become a social, political turning point. Like there's so much more than just, oh, we need the medicine.
Yeah.
In the absence of a vaccine and with limited understanding of how the disease is spread, those gaps left by science are filled with people's fear and jumping to conclusions and relying on maybe misinformation to fill those gaps.
Tons of misinformation. Well, I heard this. Well, I heard this. Well, this makes sense.
Well, this person down the street did this and it helped. And so that fear shaped public policy and justified the extreme quarantine measures. And it fell most heavily on the poor and immigrant communities, especially on their children specifically. Not to say that quarantine shouldn't have been an option. I think it's the fact that they used quarantine to specifically target groups of people. That's where it got fishy.
Absolutely.
Polio, as you said before, does not discriminate, but society does. Society has deep divisions of class, race, and economic power. It does. it possibly will always be this way.
I think it'll always be this way.
And so polio, a virus, and the things we talk about here, they don't discriminate, but the people do.
Yeah. And they always find a way to make it clear.
Yep. At the same time, the epidemic forced modern public health into action. So this is like why I chose 1916 and not the 1950s epidemic, is because this is the first time we have real public health pushing into action, like trying to find a way to keep people safe. And so the citywide surveillance, the emergency hospitals, the standardized reporting, public education campaigns, all those organized responses came because of the epidemic, which we still use today a lot.
Yeah.
And so many of these measures came a little too late, which is probably why 1916 was such a big epidemic, was because they didn't even know the epidemic had started yet, so they had a late jump on it.
And that's always going to happen, right?
Yeah.
You look back and hindsight's 2020.
And usually viruses like this are always more critical in the early weeks.
Yeah.
Right. So, but it's really hard to know that if you can only see the symptoms weeks after. So some lessons learned. We learned about transparency, early intervention, the dangers of scapegoating, and how this might influence how future epidemics were handled. Yeah, that book was really interesting that I was reading. I did not get to read the whole thing, but it's so fascinating to read some of this medical history about how they came to the decisions that they came to, and then how that shapes even today's responses to epidemics.
Yeah.
And pandemics.
Yeah. And we're going to see that when we move on to HIV and AIDS and that epidemic as it starts, that there's also a horrific response there. So we're still learning.
We're still trying to figure it out. Yeah, I mean, you could say COVID, the response there. There's always more to do, right? There's always something better.
Yeah, I agree. And we're learning.
Yeah.
Slow. Very slowly.
I think it's because we keep forgetting about history.
We do. We do forget about history and how severe things were.
Yeah. And we just blow it off instead of learning from it and trying to adapt. We're just here to talk about it.
Just here to talk about it, spread the word a little bit.
Yeah. So that's polio and the epidemic of 1916, specifically response from New York City's health department.
Yeah. I thought that was super interesting. Also, like, does the end justify the mean? I don't know. That's so hard to determine, but here we are. If you want to support us, you can follow us on Instagram or TikTok. Instagram is _cadavers_lessons. TikTok is now at _cadavers.lessons. Hopefully one day we'll get those pieced back together.
Yeah, we've been struggling with that TikTok.
We're getting there.
I don't know if it's because we're millennials or what. I don't know what's happening.
You can support us at buymeacoffee.com/the_cadavers_lessons, which is a one-time payment to help us keep this going. We really do enjoy doing this. You can listen on Spotify, Amazon, and Apple at this point. And it's really helpful for us if you leave a review, if you share our podcast with anyone that might be interested, leave a comment, anything like that. It's really helpful. So if you ever have an idea for an episode or a case, you can DM us on social media, any fun stories, anything like that that we can share. We're excited to start diving into this. Our next week's episode is on
HIV and AIDS.
HIV and AIDS.
Which is massive.
Which is massive. It is going to be a 2-part episode. There's so much to know. There's so much to understand here. I'm really excited for this episode.
Extremely complicated.
Yes.
Yeah.
Yes. And that's it for today, friends.
Yeah. Thanks for joining us.
Class is dismissed.
Stay safe.
Stay curious.
And don't try this at home.
Unless you own a bone saw.
Yeah, don't be trying polio.
Yeah, let's not do that. Let's be done with that one.
Let's be done with polio, please.
This podcast is for educational and entertainment purposes only. We discuss the history of medicine, not your personal medical situation. Nothing you hear on this show should ever be taken as medical advice, diagnosis, or treatment. Some of the information discussed may be incorrect or become outdated over time. We do our best to stay current with medical knowledge, but medicine changes quickly. Additionally, because we do not work in every specific field we discuss, there may be times when we misspeak or misinterpret information. We're all human and we're doing our best for the podcast. Every medical case is unique, and your health decisions should always be made in consultation with your own qualified healthcare professional. If you have any questions or concerns about your health, please reach out to a licensed provider who can give you guidance based on your individual needs.